Welcome back to the broadcast. All week, we're highlighting a person in North Texas who's been a driving force in the fight to help raise awareness in heart disease. Today, we're sitting down with Dr. Naina Azrani from Texas Health Resources. Good morning and welcome.
Thanks for having me.
It's good to have you, and I'm very interested in this topic because I know it affects me personally as a woman. It's the #1 killer of women, but yet so many women still don't know enough about it. Why is that?
Well, you're absolutely right. And so heart disease is the #1 killer of both men and women in the United States. But it's kind of been traditionally treated as a man's disease. So when you ask American women what is their biggest concern about their health, only 1 in 5 will say that they think that it's heart disease. And so really it just boils down to awareness. We need to do a better job of conveying to the American women in particular that heart disease is a big concern. It's the #1 killer, and they need to be concerned about it not only for themselves but also for the other women in their lives.
Right. We hear so much about women dying from cancer, be it breast cancer, what have you. But my question for you is just really layman's terms. I want to know exactly what you mean by heart disease. Please help me understand this.
Yeah, absolutely. So that's actually, in some ways, a difficult question because a lot of people say heart disease and they mean different things. But in general, when we talk about heart disease, the heart is a muscle. It sits right there in the center of your chest, and it pumps blood to the whole body. And that heart muscle is fed by arteries, and those arteries are called coronary arteries. So if you think of the heart as a muscle, these arteries kind of wrap around and give it that very important blood flow. When we talk about heart disease, we're talking about blockages in those coronary arteries. And if those blockages are bad enough, then you don't get enough blood flow to the heart muscle. The muscle doesn't work as well. And if it's a sudden blockage, it can cause a heart attack.
Okay. I think I'm starting to understand now. So we're talking a lot about blockage.
Absolutely.
And we don't know that we're just walking around with blockage until either we have a sign, which could be like what?
So that's one of the things that's been more difficult for women. I think when you look at the media and you think of a heart attack, you see someone who's doing fine and then suddenly they turn pale and they're sweating and they're clutching their chest and they just look terrible. Women don't necessarily present that way. Women often feel kind of a vague discomfort, a little short of breath. They don't necessarily feel it in their chest at all. They can feel it.
A discomfort in the chest, or
can be in the chest. For women, more often though, sometimes in the jaw, in the shoulders, in the back, down the arm. Sometimes it's not even pain at all. It's just kind of a vague discomfort. I just don't feel right. More short of breath. Particularly if those things are happening with exertion, it's worth talking to your doctor about.
So just stay very aware of how you're feeling.
Absolutely.
My grandmother passed away many years ago, but when she woke up the day she died, she just said, I don't feel good. I just don't feel good.
Right.
So I think that might have been a good sign for her, and this was way, way back in the day.
And that's very important. I think women actually have very good intuition about their bodies and about knowing something's not right for me, something has changed. And if that's the case, then it's important to follow that up with your doctor and make that known.
Okay. How important would family history and genetics play even more into that?
Those things are very important. So particularly when you're looking at younger women, and younger women are not immune from heart disease. In fact, if a younger woman has a heart attack compared to that same age man, she's at a higher risk of dying compared to that same man. So it's very important. Younger women, we tend to underestimate their risk. And one of the strongest risk factors in those younger women is being aware of your family history. So if your father, if your siblings have died early, if your mother has had a heart attack or stents or bypass surgery at younger ages, those things are very important that your doctor is aware of because we will treat you differently. We're more aggressive in how we manage your risk factors to prevent you from getting heart disease in the first place.
And does stress play a big role in this as well?
Yes, and more so for women than men. And
stress
so
more for really?
Women, yes.
See, I would think it would be more for men.
And that's one of those things, you know, part of the problem with women and heart disease is that the medical community as well has underestimated the risk for women, and we tend to think, you know, a woman comes in and she's got some chest pain, but it's worse with stress. That's probably just anxiety. It's probably not her heart, and that's not true. They have shown that for women, one of the things that precipitates the discomfort and symptoms that they may feel from heart disease is stress and anxiety and all of that. So
And
just because it's related to that, it does not mean that it's not your heart.
That's right. And women carry a lot of that.
Absolutely.
Absolutely. Well, thank you so much for coming in this morning. I do appreciate your information.
Great. Thanks for having me.
Don't forget to go Red for Women Luncheon. It's sponsored by the American Heart Association. It's being held this Friday at the Anatole Hilton. Former Vice President Dick Cheney is the keynote speaker there. Get your tickets by going to thebroadcasttv.com and then click on today's links. Still to come on the broadcast, we're cooking up a special dish from the Valentine's Day menu at Dallas Fish Market. We'll be right back.